thank you for thinking about and answering the questions you were greeted with when joining this morning. Together, you're a very broad and diverse group of stakeholders from across a range of areas of public protection. It is your active advice and knowledge that is important today, and thank you for all your commitment to this crucial cause. It is absolutely lovely to see so many people here this morning. This year, we are asked to imagine a world without violence against women and girls, a world where we are all equally safe. As chair of today's event, I want to emphasise our collective responsibility to turn this vision into reality. We must work tirelessly to prevent and address all forms of violence against women, ensure survivors have access to comprehensive support services, and hold perpetrators accountable. Since 2014, the Convention of Scottish Local Authorities and the Scottish Government have co-owned the Equally Safe strategy. Recently refreshed, the 2024 Equally Safe Delivery Plan includes a commitment to strengthen links between violence against women and girls and other areas of public protection, prioritising actions to prevent harm and improve outcome for victims. This morning, we will explore opportunities for collaboration to enhance public protection and support for women, children and young people affected by gender-based violence and abuse. Our speakers and panel guests will highlight connections between violence against women and girls and areas such as child protection, adult support, alcohol and drugs, suicide prevention and MAPA. I hope this inspires us to find new ways to work together on shared priorities. Your participation today is really important and will help shape the next steps in achieving these goals.
Okay. Yeah, good morning, everyone. I'm really pleased to be part of this national event, and I'm particularly delighted the logo that has been produced for this, I just thought was amazing, and I couldn't not get my own one, so I now have it. So definitely feel part of this virtual room, that's for sure. So as I said, it's lovely to be here alongside my Equally Safe co-chair, Councillor Chalmers, and thank you very much, Maureen, for your opening remarks, reminding us all of the important work that we do and why we're here. This campaign, as with every year, is a powerful reminder of the importance of addressing violence against women and girls. It's also a reminder that it is only through our collective endeavours, working together across the system, that violence against women and girls in Scotland can be eradicated. And I do believe that it can be eradicated. A little bit of background. As you will be aware, this time last year, we refreshed our Equally Safe strategy. The refresh enabled us to reflect on changes in both the social and legislative landscapes, such as the growing diversity in Scotland. Importantly, the refresh strategy emphasised the importance of working together across society, across sectors, and across all of us, actually, in order to eradicate violence against women and girls. We know that the change we want to make will not happen without this collaborative approach. Our refresh strategy also places emphasis on tackling the root cause of the problem, gender inequality. Since the refresh, we have worked with Equally Safe Joint Strategic Board and our mainstream and specialist services to identify the key deliverables and actions that will enable us to realise our ambitions. Our delivery plan, published in August, is Scotland's delivery plan to tackle violence against women and girls, with key actions not only for us as the Scottish Government and COSLA as co-chairs of the strategy, but for organisations right across both the public and the third sector. Taking a collaborative approach to moving the delivery plan forward is so vital. All spheres of government and wider society have a role to play in tackling this issue. And this is why our plan contains such a range of deliverables and actions that span across education, health, justice, housing, and why we're here today, public protection. Through these deliverables, we all commit to maintaining our momentum in addressing violence against women and girls and realising our ambitions under the wider strategy. So regarding public protection, I'm aware that many of you joining this workshop will have engaged in the wider development of the Equally Safe Delivery Plan. We all acknowledge, as noted in the plan, that addressing violence against women and girls is such a key element of public protection. We heard during engagements how victim survivors of domestic abuse may encounter multiple parts of the public protection system, with support links not always being made. Families may, for example, be engaged with adult support and protection, child protection, and mental health services all at the same time. In this virtual room, we all know that it's vital that those who are at risk of harm or who are experiencing harm get the right help at the right time. I am aware that there is a huge amount of knowledge and experience from across the public protection system in attendance today, and this provides us with a great opportunity to take the first crucial steps towards together meeting the delivery plan action. How do we overcome silos to ensure collaborative working, prevent and reduce harm, and improve outcomes for women and girls who are experiencing domestic abuse? I'm also aware that nationally, with the establishment of the National Public Protection Leadership Group and within the Scottish Government with the establishment of the Cross-Government Public Protection Team, there are initial, broader steps being taken to better protect people. This helps to build on the work happening in local areas and to understand the risk factors that cut across protection areas. So as we progress through today's agenda, I look forward to hearing more about the local examples of integration of violence against women and girls in public protection, but also the wider discussion on what we collectively need to do to move the action forward. So thank you very much for listening. And I will, on that note, pass back to Councillor Chalmers to take us through the next part of the session today. Maureen, thank you.
My name's Sophie Gwyther and I'm a lead officer in the Protecting People team in Dundee. I previously held the remit for Violence Against Women Partnership Strategic Support as well as Child Protection, and I'm now the lead for the Children at Risk Committee in Dundee as part of our new public protection structure. So I'm going to be talking a little bit about how Violence Against Women Partnership is situated within that structure and how it's working in Dundee. The next slide. So I always think it's really important to kind of go back to a much earlier time than me being in post when I think about how we've got to where we are with violence against women and public protection in Dundee, and acknowledge the work that's been done probably over a 10-year period, I would say. So we had key individuals who really laid the foundations and held a vision of where they wanted to get to with public protection and how they incorporated violence against women into that. So just really, really quickly, because I don't have a lot of time, I think that what those people did and that leadership did was they made the risk and the harm around violence against women visible within public protection. So they made sure senior leaders and senior managers understood the harm experienced in the city in terms of violence against women, and also focused on the risk to them as organisations if we didn't identify and respond to that risk effectively. They focused on proving value, so piloting initiatives and projects and then building an evaluation so we could kind of prove that value, and was a really important part of it as well. And there was a lot of persistence and goodwill. So particularly operational staff who were involved in those kind of early tests of change and pilots, people really working off the edge of their desks to try and make things work. And that came from the confidence that these approaches were really what was needed, and people knew that, so they were willing to put in that extra time to make sure that it happened. So those were some of the things. I think the structures, again, has been a key factor in Dundee and how we've progressed. So the Violence Against Women Partnership was located within the public protection structure it's been there for years, and there's been a strong commitment for that, and it has equal footing with the other committees such as Child Protection, Adult Protection and the ADP. And as such, it then reports directly to the Chief Officers Group, as do the other committees, and so it's got that kind of oversight, leadership and scrutiny. And then the strategic support team for all the partnerships and committees are located together in one team. So that's been really beneficial for communication, for developing this kind of integrated approach that we've now moved to, and the sharing of developments and ideas. Okay, move on. So this is just a little slide. You probably can't see all the detail on that, but this is how we've kind of started to think about the protecting people approach, as we call it in Dundee. So we've really tried to highlight this sort of interconnected nature of all the work underneath public protection, and develop this diagram to try and demonstrate this. So I think that COVID was something that really accelerated our thinking around this. We'd already started to think about it, but very quickly when the pandemic hit, we realised that so many of the risks that we were identifying in the different areas of public protection were shared and not sitting in silos. So particularly around violence against women, it sort of really brought it into people's vision in a way that it hadn't done before, in terms of thinking about child protection and what was happening to children in homes and so on. So it really kind of assisted us in how we pushed forward with this approach. I'll probably leave it at that for that slide if we could move on. We've done a lot of work as well around the functioning of the Violence Against Women Partnership. So again, trying to kind of really bring it into line with the other public protection committees. So we had a really kind of good look at the membership and making sure we had the right people there with the right level of seniority and authority. We developed a strategic plan and kind of really went through a strategic planning process to do that. And that reports to the chief officers, like the other committees do. And then our subgroup structure was something that we really looked at as well. And I did a lot of looking across to the Child Protection Committee to see how that worked, and then bring that over to the Violence Against Women Partnership. So we brought over a scrutiny subgroup, which looked at data. So we tried to improve the data we were gathering around violence against women, and how we were then scrutinising that data and using it to inform the decisions of the committees. Similarly with quality assurance processes, we've kind of lifted that across into the Violence Against Women Partnership. Okay, to move on. So kind of looking more closely at violence against women in Dundee, alongside the sort of the existing foundations that have been laid, the situating of violence against women within the public protection structure, the kind of functioning of the committee and developing that integrated approach. We also did a big piece of work pre-COVID where we looked at violence against women pathways in Dundee, to see what were we missing, what were the gaps, what were the priorities. So this was part of our strategic needs assessment, I suppose, and it informed our strategic plan going forwards. So from that piece of work, we agreed the focus and priorities, and there were many of them, as I'm sure you can imagine. But the one that we really settled on was that we needed to increase the capacity of non-specialist services, so non-violence against women services, in terms of addressing the needs of women with complex issues. And in Dundee, that was really important because, as many of you will be aware, our demographics are very complex. We have high rates of domestic abuse and sexual violence. We have high rates of drug deaths, and we have high rates of suicide in Dundee and high levels of poverty and deprivation. So the women we were looking to support in Dundee often came with huge numbers of multiple disadvantages and complex issues. So we really identified that we needed to move away from just looking at violence against women in terms of those specialist services and look much more broadly. But at the same time, we needed to look at those specialist services and look at the capacity and demand issues that we have had historically and which continue, and I'm sure are familiar to everybody. And from this work, we were really looking at trying to develop a collective leadership approach to violence against women. Move on. So some of that work that we did through the pathways and that kind of focus that we then took on non-specialist services was again accelerated by some external factors. So one of those was the Drug Commission in Dundee, where the report was published in 2019. And as it says on the tin, that was looking at the situation around drug deaths in the city. But within that, there was a very specific recommendation made around taking a gender mainstreaming approach. So that gave us a really good springboard to kind of accelerate what we were already thinking. And then we also had a piece of research carried out, which was commissioned by Dundee Women's Aid and carried out by the University of Dundee, which looked at a gendered approach to service provision, and clear recommendations were made around services and responses to women and what we needed to do better to meet their needs more effectively. So those things were happening. Can we move on? And from that, the Gendered Services Group was born. And this isn't the only kind of integrated group that we have, but it's probably the earliest one and the one that's driven the violence against women work through the sort of public protection structure most strongly. So the Gendered Services Group was a broadening out of, it sat underneath the Violence Against Women Partnership and the ADP. So in recognition of what I said about the sort of demographics in Dundee, we needed to have that kind of broader look at the needs of women in the city. So the Gender Services Group was developed, and essentially the remit of that group is to look at the most vulnerable women in the city, to understand the needs that they have, to make sure that we're fulfilling that, to provide leadership on development of those services that might be needed, and really kind of opened up huge possibilities in terms of collaborative working at both a strategic and operational level. Next slide. So from the Gender Services Group, I hope everyone's keeping up because I'm rattling through. We managed to secure funding from Cllr for the Gender Services Project. And that was really a very dedicated post and project to take forward this vision that we had of upskilling all the services in the city that may have contact with women to be better able to understand the specific needs of women and to be able to meet their needs. So we have had Heather in post for, I think, nearly 4 years now, and she's looking at embedding those gendered approaches in service delivery across the city. And really importantly, the whole project has been driven from the very beginning by the voices of women with lived experience. So there's literally nothing that the project does without the involvement of women with lived experience. So just really quickly, the project delivers training that's been designed. There's a self-assessment tool that can be used. The project will then support a service to look at any actions coming out of the self-assessment in terms of changes, and there's a whole lot of resources being developed. And then if services go through that process, they then are awarded a charter mark, which you can see there on the screen, welcoming women, so that women know if they go to a service, they're going to get a certain standard of delivery and response. So training at the moment, I think, has been delivered to well over 400 participants across the city and well over 20 different organisations. At least 26 women with lived experience have been involved in all the different pieces of work that have gone on. It's probably more by now. They've created films, podcasts, digital learning resources, resources like cards and illustrations, animations. The women designed the logo, and they've also been involved in designing the self-assessment form. So really, really kind of involved in the project. Okay. So just some other examples really of how we kind of broadened out this ownership around violence against women and women more broadly. So housing in Dundee, from input from Heather's project and the Gender Services Group, recognised the need to have some gender-specific temporary accommodation because women were telling us that they did not feel safe in mixed gender temporary accommodation, so hostels. So housing have repurposed one of their blocks, their temporary accommodation blocks, so it's now a women-only block, and there are 11 self-contained flats, and it is for women who are, the most vulnerable and in need of the most support. There are 2 specialist workers based there, funded through housing from Dundee Women's Aid, who provide that on-site support. There are really close links between the Honey Green accommodation and Dundee Women's Hub, which I'm going to speak to in a minute. There's 24/7 staffing from housing. It's all been designed in a very trauma-informed way, influenced by lived experience, and we're starting to gather the outcomes and evidence from that now, and really, really positive results in terms of the outcomes for women so far. Dundee Women's Hub is one of our things that we are most proud of. So again, very much coming from the Gender Services Project and the Gender Services Group, and hearing what women were telling us, that, you know, there was stigma associated with going to certain buildings, or the risks that they faced in terms of bumping into people in certain locations. So from that, we came up with the vision that we needed a very specific women-only space where women could access all the different types of support that they might need. And so again, we got funding from Cllr, and we've been able to open Dundee Women's Hub. It's an absolutely multi-agency hub. So the lead is Women's Rape and Sexual Abuse Centre. They kind of run the hub, but it's staffed by all the different agencies that you can see there on the screen and more now. So that it's a kind of drop-in basis, but services can also use the space to do their one-to-one support or any kind of group support that they want to do. There's, you know, basic access to things like a shower, clean towels, there's a clothing bank, there's a little food bank, there's, you know, women can just come in and have a cup of tea if that's what they want. We're just working on a reflective garden at the moment. So the Women's Hub has been a huge kind of piece of work that we're celebrating in Dundee, and it's been open for a year now. So again, we're just gathering the outcomes and evidence for that. So that's just a little whistle-stop tour examples of some of the things that we've achieved by that violence against women being situated within public protection and not seen as sitting in a silo on its own, but absolutely woven into ADP, into housing, into child protection, adult protection, and all the other areas of public protection. So just really quickly in terms of where we are now, through all the elements that I've spoken about, so those foundations, the external factors that accelerated things like the Drugs Commission and COVID, the Protecting People approach, and all this collaborative work that we've done, we've now found that ownership of violence against women has really widened out, and the commitment is there. I've given some examples, but there are many more. The funding situation, as everybody knows, is incredibly tricky at the moment in terms of violence against women, but because of this collaborative integrated approach, we've been able to do some good work in terms of funding locally. I don't have time to go into that now, but things like partnership projects between the council and the violence against women specialist agencies, mainstreaming of some services, developing a kind of an early commissioning model with a funding group. So those are just some of the things that we've done. Collaboration between the main violence against women specialist services is also really strengthened, and those services have between themselves realigned things so that pathways are more efficient for women and children and young people. And again, just the visibility of violence against women within public protection, I think, has really been strengthened. And there's a quote there from one of the specialist services managers talking about our funding approach. So she said, "We've been really open on what we receive, where there are gaps and what the gaps are. It's no longer a service issue, it's a community and Dundee issue. We've supported each other to go for funding and made it a coordinated approach, getting rid of those egos and fear about things. It's no longer my service, it's Dundee services." So that's just an example of kind of how we've managed to shift things across. And I think that was a absolute whistle-stop tour of violence against women in public protection approach. I hope it made sense, and thank you very much for listening.
Thank you very much. My name's Hamish McGhie. I'm the independent chair for the Dumfries and Galloway Public Protection Committee. I've been in post now for just over 3 years. As by way of background, I'm actually was a senior officer in the Fire and Rescue Service, so I don't actually come from one of the normal mainstream agencies into this arena. What I intend to do is give you a quick overview of our public protection arrangements, how violence against women and girls fits into it, and finally give you some of the benefits that we see and some of the challenges that we see moving forward. We started our journey in 2018. It was just the start of a journey. We continue to be on that, but it wasn't fully realised until after the pandemic and COVID. But now we are fully integrated as a public protection partnership. Next slide, please. As I said, we're fully integrated. We have one committee. It's a public protection committee where all partners sit around the table. It includes agencies such as education, the prison service, justice, colleagues, NHS, health and social care partnership, etc., etc., etc. As you can see there from the top, it has a very broad terms of reference. And because we don't have a lot of time, I won't spend too much time, but if I could just highlight the bit at the bottom where it says manage areas of overlap across the public protection fora. And that's purely what that is. It's about making sure that we have a more holistic and broader view of everything that's going on. The Public Protection Committee in Dumfries and Galloway sits every 2 months, but the Chief Officers Group sits monthly. So there are other ways in which Chief Officers are kept up to speed other than just through the Public Protection Committee. Next slide, please. So this gives you an overview of the structure within Dumfries and Galloway. As you can see, there's a lot of information there, but it shows you the escalation process that we have, the scrutiny and governance. And you'll note in the second bottom line on the right-hand side, there's a Violence Against Women and Girls subcommittee. They have clear lines of communication and escalation through the Public Protection Committee, and it can then go to COG. A couple of examples of that have been their anxiety around the DES funding as it sits right now, but also they've asked for areas of concern around DASHRIC training, which has been escalated to chief officers, and they've been supporting them in doing that. As we go through the presentation, you'll also see that we have developed locally a minimum data set for violence against women and girls, and they are fully included in our performance. That subcommittee doubles up as a scrutiny committee, so they again are able to scrutinise all the information that comes in through performance, and that is also escalated on a monthly and a quarterly basis, both to the PPC and the Chief Officers Group. Next page, please. So I put this one in because it sounds like, pretty common sense that we now see violence against women and girls as one of our core pillars, but we in Dumfries and Galloway have generated a single public protection strategy where it clearly identifies that violence against women and girls has an equal standing to adult support and protection and child protection. That's how the actual strategy is set out. We also, as I've said, we've developed a performance, quality and assurance framework, which violence against women and girls is completely embedded in. It provides a much more holistic picture, and I'll show you a couple of slides in a minute where we have performance on a page, and you'll note that on that page it has information relating to child protection, adult protection and violence against women and girls, so that when it is viewed it can be seen in that more holistic picture and we can see the crossovers between them. I will say this all looks good, but it is in continual development, and we know we have a long way to go, but it is we believe that we're on the right trajectory. If we could go to the next slide. There's a lot of information on this, folks. Don't expect to go over the whole thing. This is an excerpt from our 2023-24 annual report. It basically shows you, as I said earlier, performance on a page showing all the 3 areas. These, as we call them, are the kind of high level. Below that, there is a lot more data and a lot more scrutiny takes place, but this is the sort of thing that would come to our Public Protection Committee or Chief Officers Group, and it would come with context, and it would allow them then to ask the questions of what that data actually tells them. And as you can see, we go all the way down even to homeless, the number of homeless applications that we're receiving. So they get the big picture, and I can assure you that chief officers are very keen to ask very in-depth questions around it, and we're kept on our toes. The next slide, please. This just goes into a bit more detail in terms of that more holistic picture. Again, not going to go into it in too much detail, but what it shows is the overlap of data for domestic abuse across the last April 23 to March 24. It shows you how we're able to interrogate and look at that picture and look at the crossovers and what's influencing others, and allows us to identify the challenges and also making decisions for the partnership moving forward. Okay, next slide, please. So the benefits that we find are that we have a great deal of ability to share skills, expertise and resources, and it probably goes to a little bit about the structure you saw earlier. We have the 3 pillars. As I say, we have one strategic plan, not 3, just one. Our public protection structure provides a single learning and development, policy and procedures, communications and engagement development, and the ability to share learning from learning reviews, etc. It brings together the wider expertise, knowledge, and above all, fosters innovation. It allows us to look at things differently and to bring in people's where they think they can or provide us with something a little bit different to get rid of some of the wicked problems that we currently have. It also has, as I said, the development of joint strategies, shared priorities, holistic, one view, one vision. We have a clear escalation process where something is identified within the Violence Against Women and Girls subcommittee. It's then escalated up through with clear business case and clear rationale, and allows them to have access to chief officers who then are able to support them. In terms of coordination, again, that training, communications and policies, there's often a crossover between the Violence Against Women and Girls, child protection and adult support and protection areas, and we're able to take things forward. Some of the areas we're talking about is trafficking, revenge porn, and we also have a strategic public protection team, which I should have said during the structural part, that is a dedicated team who are able then to support these activities. We had one of our conferences on Monday, and the support team were able to run that with the assistance of the third sector and specialist services. And the Violence Against Women and Girls data scrutiny, that's a new thing this year. It's able to give an overview of the increases in demand, establishing the reasons for these, shared intelligence, and highlight through monthly and quarterly reporting. And it allows people to see a true picture of what is actually happening out there. Moving on to the next slide. So there's a bit of crossover here with Sophie's presentation. Funding is obviously one of the top challenges, as is seen by all at the moment. Taking it slightly wider, the funding source differentiation is difficult in terms of what it is for statutory service and those for specialist services. The short-term procurement areas where we can't actually do longer-term planning within our public protection planning because we're unsure of how much is going to be given to these services. That links into the challenge of perception. There is long-standing perceptions within the specialist services about that funding approach in terms of where the statutory services sit and how that is perceived in terms of whether they're taken notice of. And we're still working on that. And we're actually currently, we will have one of our specialist services members will be presenting funding challenges to our chief officers in person at our next chief officers group meeting. There is also a bit of I know it sounds silly, but there's a bit of a challenge there around about being known as a subcommittee. That for some has been a bit of a negative connotation, that previously they were a partnership, but the problem being that at that point as a partnership, their escalation route was very difficult, and it's very easy. So we're still working on that to clarify that with them. In terms of communication, again, working with the specialist services, and we're in to try and fully integrate ourselves. We're finding it difficult to find a common communications platform that allows everybody to access. And even the simplistic things of the feedback loop within our communications loop, we know that isn't working properly because we know that some of the good stuff that we're doing isn't getting back to those that need to know. Violence against women and girls is wider than public protection as it stands within Dumfries and Galloway right now. So community justice partnership, alcohol and drug partnership, around about equality and diversity, all those sort of things we're still struggling to integrate in there. But what I will say is we have very good links to these other partnerships, and they do sit within the public protection arena in terms of sitting in public protection committee, but we have more work to do in that area. And I guess the integration part is that what we're finding now within our experience is that we've done the easy wins, you know, bringing people in and actually the stuff that's very process driven, but there's a lot more that could be done if we were able, with funding, with potential legislation change, et cetera, et cetera. There is that integration where we're now at the point where the next stages are more difficult in order to get it to move forward. That's a whistle stop tour, folks. There's so much more I could give you, but hopefully it gives you an understanding of where we are within Dumfries and Galloway. And again, just to re-emphasise, it's a work in progress, but we believe we're on the right trajectory. Thank you.
So, without further ado, I'm going to introduce our panel members, and hopefully they'll pop up on the screen. If I'm not seeing them already, you'll see them. So, first of all, Tam Baillie, Chair of Child Protection Committee Scotland. Morning, Tam. It was good to see you recently as well when we were in Glasgow. Good. Elaine Torrance, Chair of Adult Support and Protection of the National Convenors Group. Haylis Smith, National Delivery Lead of Suicide Prevention at COSLA. Sarah Graham, Organisation Lead, Preventing Alcohol Harms from Public Health Scotland. And finally, Detective Superintendent Stevie Bertram, Public Protection Command at Police Scotland. Now, each panel member has about 8 to 10 minutes in which they're going to respond to the following questions. Where are the key opportunities to strengthen links between violence against women and girls and your public protection area to both prevent and reduce harm and to improve outcomes for victims and survivors of violence against women and girls? And what actions are needed to ensure this happens? So we're not going to stop for questions between each input, but after we've finished everyone speaking, we'll move into a whole group discussion, which the Improvement Services Protecting People team will facilitate. So hopefully that's clear. So I'm going to just, with no further ado, invite Tam Baillie as our first panel member to take the floor. Thanks, Tam.
Okay, thanks, Maureen. I'm not coming with a presentation. I hope that's okay. I'll just speak to camera since it was a discussion. So firstly, it's about the central positioning that domestic abuse in particular plays in child protection. You could almost say it's mainstream because it's the main reason for children being on the Child Protection Register. That's what our latest children's statistics tell us. And it's also one of the most significant reasons for children being referred to the Children's Reporter. So there's already a lot of local activity that's taken in terms of responding to children and families that are experiencing domestic abuse. In terms of the sort of strategic positioning, you've heard good examples there from Sophie and Hamish, and there are other examples across the country by way of necessity because of that number of domestic abuse referrals that are affecting our children. So in one sense, I think there's a reassurance there that it's absolutely central. And the other one, though, is, and it's been mentioned earlier, is about the funding. And it's surprising that we've got this mixed funding package, if you like, for responding to children that are affected by domestic abuse. I think it's a good move to try and put it onto a statutory footing, but it's not such a good move to try and put it onto a statutory footing if that means that some of our services are not able to access some of the funding that they currently have. So that's a major challenge. And I know you're asking for opportunities, but with each opportunity in terms of how we might change the funding structure comes its own challenges. So I think we need to be very careful about how we progress with that. But generally, I welcome moves to bring the that service provision much more clearly and on a statutory footing. If I can mention another issue that's rearing its head, previously when I was Commissioner for Children and Young People, we had a focus on what was court-ordered contact for children. This is situations where the child is, the access arrangements for the child when a couple split or a couple are not living together is ordered through the courts. Sometimes it's euphemistically called safe contact, but it's most often not safe contact at all. And there are continuing concerns about children who are subject of court-ordered contact in situations of domestic abuse. And the main reason here is because of, it'd be too critical to say inappropriate information. Sometimes it's not complete information to the courts. But there's a tendency for the courts to think that the best place for a child is to have contact with both parents. And in the absence of sufficiently detailed information, they'll tend to go with contact being ordered through the court. I know this because of research that we published more than 10 years ago now, but I'm picking up that through discussions with Women's Aid, the situation hasn't changed much at all. So I'm sure there'll be other people in this call who are much more closer to some worrying situations in terms of how children are court-ordered. And if I go back to those statistics, in terms of, so who are these children who are living with domestic abuse? The highest number where we're identifying through our referrals to the reporter are for children under 1. And for children under 1, it's often not known what the views, for instance, of the child might be. And if there's a tendency to place children under court-ordered contact in those circumstances, then I think we need to be worried about what impact that might have on the development of the child. So currently, Child Protection Committee Scotland and Women's Aid and Celsius, we're in discussion just now about how we might resurrect that as an issue that needs to be addressed. If I can mention something else as well, it's in relation to, I get to sit in a number of groups, one of which is the Trauma-Informed Strategic National Group. And the whole issue of, where does the trauma come from, is one that group is grappling with, and how might it tackle it. And I have to say, the violence agenda is one which I think we struggle with in terms of how we might tackle it in terms of our young people, because we don't have a structured approach in most instances about trying to reduce violence in terms of the experiences of our young people. And I can say this because yesterday I was at a youth assembly event in Renfrewshire, and I currently chair the Child Protection Committee and the Adult Protection Committees in Renfrewshire. And when the young people there were polled in terms of what's the issue that most concerns you, it was violence. The options they had were violence, safety, and substance misuse. So the concerns that we've got about violence against women and girls are reflected in our children. So I think that we've got an open door in terms of how we might be more assertive in trying to raise some of the issues that we've got concerns about with our children. And I'm using that children and young people. I think that's mainly what I want to say. One other thing, probably very significant. There's a number of people on this call just now who are a member of a group, a recently formed group called the National Public Protection Leadership Group. And I'm hopeful that group will be able to provide some overarching framework so that we are able to pull together, and it's already doing this, adult protection, child protection, violence against women and girls, suicide prevention, drug and alcohol use. And apologies if I missed out one of any of the constituent groups, but essentially there's a recognition at national level that we've got different streams of activity which are related, and we don't bring them together at that national level. And I'm hopeful that we'll be able to have a clearer strategic direction in terms of public protection in Scotland as a result. That being one element, but it's quite an important element that we're pulling things together for those relevant areas of concern. And I should say it's already reflected at local level, because you'll find that most chief officers groups, COGs as they're called, will have all of those constituent areas of work reporting to them. And you've just heard two examples there about how close an eye people keep on some of the figures that are coming through for violence against women and girls, but they also are looking across the board in terms of the suicides in their area, the drug deaths in their area, the adult protection concerns, the child protection concerns. So I'm on the side of the hopeful of being able to actually take a more coordinated approach, and violence against women and girls, they're absolutely central in terms of the areas of work that are concentrated there.
Hi, thank you, Maureen, and good to see everybody here. Like Tam, I'm just going to talk, so I haven't got slides, so hopefully that works for people. So yes, I'm Elaine Torrance. I'm the chair of Dundee's Adult at Risk and Children at Risk committees, but you've already heard about all of that from Sophie, so that's great. But I'm here in my capacity as chair of the National ASP Independent Convenors Group. And we've also heard a lot about the increasing understanding about the links between public protection overall, but particularly the links between adult support and protection and violence against women and girls, which I just want to focus on for a little few minutes as part of this presentation. And nationally, we've been trying to support this agenda and get a conversation going. And in November last year, there was an Aspire event, which is an adult support and protection, innovation and research event. And we explored this topic, and we've got a few further event planned on the work of the Women's Support Project and commercial sexual exploitation coming up too. So we have already begun this debate, and we'll be following on from today as well. You've heard about the move towards the new integrated structure in Dundee from Sophie. I would just say that there was a bit of concern about the possible reduction in focus about violence against women and girls by doing that. So I think we have to acknowledge that by changing structures that there are some additional concerns that get highlighted. But certainly from my point of view, as chair of those groups, it's absolutely strengthened links with our third sector organisations very, very quickly. And I think it's raised the profile, and we've got much better data coming through, and cross-cutting learning reviews that are coming through too. So I think we've mitigated against that, but just acknowledging that perhaps is an issue that can come and people can get concerned about. So in terms of opportunities, there's so many similarities in terms of legislation and context between adult support and protection and violence against women and girls. So we're all got a human rights focus, absolutely, protection of human rights focus. There's always a balance between individual rights to freedom of choice and protection from risk of harm, and how do you balance that? There's respect for self-determination and autonomy versus a legal duty to cooperate and protect people. And there's a need for strong multi-agency collaboration, information sharing and communication. All of those are absolutely the same issues right across the whole public protection agenda, but particularly focusing on adults and violence against women. And as Tam's already outlined, a trauma-informed approach is absolutely critical and cuts across all our work. So there are so many similarities there that I think we can draw on as opportunities. And again, Hamish and others have talked about the need for joined up data. There's so much data coming through. What I would say in terms of public protection at national level is we could join that much better together. We could do much greater analysis of that at national level because each area is providing data, but not necessarily being sort of looked at analytically right across the piece in terms of that. And again, I think we could do some more work around learning reviews. I was looking at some reports in England recently, just as part of this today, preparation for this today, and 16% of learning reviews featured domestic abuse in England. It's interesting if we kind of do that analysis across our learning reviews in terms of adults and just see exactly what the connections are there. And as part of that, I just wanted to mention one of the learning reviews that we took forward in Dundee, which people may have heard of before, but Miss L, a 29-year-old English black woman who'd lived in Dundee for 2 years, complex case featuring domestic abuse, homelessness. She had mental health, long-standing mental health condition, physical health condition. She had diabetes. She was being sexually exploited. There was drug use. And ironically, she had moved up to Dundee from down in England to escape a violent partner and moved to her mother-in-law's. And of course, he immediately reappeared on the scene. So she even had less supports than she probably had down in her home area in England. But the services all worked really hard to work with Miss L, and that's very clear from the work that we did. But she was very, very difficult to engage with, and one of the very complex cases. And I don't think that scenario that I've just painted will be unfamiliar to other parts of Scotland either, these very, very complex cases. And some of the areas that there was also community justice involved because she was on an order down in England. So we picked up through that the important links with MARAC. And this Miss L had been considered at 2 MARAC meetings, but didn't feel that she reached the threshold for adult support and protection. So, you know, there were services going in, and I would say the third sector came out really, really well. They had the time, they had the ability to gain trust and provide support for this, for Miss L. So that they worked really, really well, as did all our services trying to help her. But unfortunately, she died. But I think there was also evidence that although we talk about trauma-informed practice, there was evidence of services still sending the standard letters out to her, saying, come along to this clinic, knowing full well that given her history, that would never happen. So, you know, taking a trauma-informed approach is really, really important right across all our services areas, and I would say there was more opportunities for us to work together as well as part of that. So I just wanted to highlight a few areas that I think of what could be done, because that was our question today. I think there's 3 levels, I think, as which we can work. There's the practice level, what can staff do on the ground? There's the strategic level, and there's the national level, and I just want to make a few points in terms of those. So at practice level, training, learning and development needs to be really effective. So all staff, wherever you're working, even if you're in a specialist service area, you're familiar with both adult support and protection policies, procedures, and also violence against women policies and procedures. And perhaps we need a better overlap in terms of those as we move forward. Domestic abuse can involve the wider family. Tam's just explained that a little bit in terms of his, but we're very complicated in terms of adult areas, particularly a number of adults may also be dependent on that person for caring responsibilities. So you maybe have a physical disability, and that absolutely makes additional complexities. And how many refugees, for example, have places that are available for people with disabilities? Probably very few. So, you know, how do we deal with the more complex caring responsibilities that people have, domestic abuse and violence against women and girls, and vice versa? We need to get closer understanding, and probably Tam would argue child protection as well, quite rightly. So a number of things that we need, and we also need to learn better from reviews. And at strategic level, we've talked about joining up the data, making sure people understand policies and procedures, and perhaps when they're reviewed, we need to make sure that we can have references to all of these much more closely, so they're not sitting as separate entities. And there's got to be clear local arrangements between safeguarding services and MARAC. We've done a lot of work in Dundee following that case review to join the dots there in terms of MARAC. And MARAC's a really busy structure for us. We've had to move it to weekly meetings because of the number of referrals that are coming through. But actually, how do we make sure that the links between adult support and protection, child protection and MARAC are much closer as we move forward? And lastly, for me, just at a national level, I've probably missed 101 things out just to get through the time. But at national level, I think we could join Data Up, which I've talked about a little bit more. I think we can think about the governance arrangements, public protection. I'm very supportive as well of the public protection leadership group, Tam, and I'm with you. I'm the positive. I think we can make progress here. So let's see if we can work together to do that effectively. I think we could do more guidance in this area. I was looking again in terms of some of the things that were available, and I found this document, which is Adult Safeguarding and Domestic Abuse, which is published down in England by ADAS and the Local Government Association. That's really got some useful information about a guide to support practitioners and managers when you're working across areas, and perhaps that's something we could think about doing at national level that might help on the ground as well. And I think the funding has already been well outlined, so I'm not going to talk about that again. But lastly, I think that whole issue about leadership, national leadership in this agenda, and I'm really pleased for having this event today, and we can help to move that forward collectively together so that we can join the dots, we can support people, and we can make sure that we're protecting the most vulnerable people in Scotland. So thank you, Maureen. Hopefully I've kept to time too. Thank you.
Hi there, Maureen. I do have slides so that you don't all just have to look at me the whole time. So I'm hoping that you can see that up on your screens now. Can you see that all right? Yeah, good. Thanks, Katie. So I am the National Delivery Lead, and whilst I am employed by COSLA, I have dual nationality, as I'd like to describe it. So I report jointly to COSLA and Scottish Government, and really I work under this umbrella of Suicide Prevention Scotland. I thought it would be helpful just to refresh or remind people, or indeed introduce you to, for the first time, to look at the vision that we have for our suicide prevention strategy in Scotland, because I think a lot of what Tam and Elaine have already said around, some of the opportunities, I believe our vision gives us, scope for a lot of that. So we want to reduce the number of suicide deaths in Scotland whilst tackling the inequalities which contribute to suicide. So that's really beginning to focus on areas where we know there are inequalities, whether that's through protected characteristics or some of the socio-economic factors which contribute to suicide, which are often the same factors which contribute to many of the other public protection issues that we've already had mentioned. To achieve this vision, we believe that all sectors must come together in partnership, and I've heard Tam and Elaine and Hamish and Sophie previously talking about that coming together in partnership and how important that is. We have third sector organisations leading some of the work under, or the work under each of the outcomes that we have, and they are a really vital part of what we do. And we hope that our communities will become safe, compassionate, inclusive and free of stigma. Our aim is that any child, young person or adult who has thoughts of taking their own life or are affected by suicide get the help they need and feel a sense of hope. And that hopefulness was something that was felt to be really important when we did engagement with our lived and living experience panels. I thought it would be helpful to kind of look at what we know around violence against women and girls and its connection to suicide. So one of the reports that has been most helpful for me in shaping our understanding was the under-examined and underreported report delivered by the Agenda Alliance in 2023. And whilst this focused on English and Welsh data, I don't expect there to be too many differences when we look at Scottish data. Just to add to this, I was part of the working group yesterday looking at domestic abuse, homicide and suicide reviews, and some of the data that we heard about there, where around 25% of all female suicides in 2021 had some report of domestic abuse through the police. It's clear there is that link in Scotland too. So we know that whilst deaths are higher, suicide deaths are higher in men, the rates of self-harm and suicide attempts are much higher in women. Around a quarter of those that were included in this report had experienced intimate partner violence in their lifetime. And we know that sexual abuse puts people at greater risk of self-harm, suicidal thoughts and suicide attempts, with women 10 times more likely than men to experience sexual abuse by an intimate partner. So we know that there are strong connections with violence against women and suicide. We also know that women who have experienced multiple unmet needs, whether that's through poverty, adversity, or intimate partner violence, or indeed all of those intersecting together, have increased suicidality and self-harm, and that those risks are greater for women who also have a protected characteristic. So I think that it's important that we are factoring this in when we're considering our suicide prevention work. Where I see key opportunities for action, we know that suicide prevention needs to be much more than acting at the point of crisis. We know that we need to work across early intervention, prevention, and at that point of crisis, as well as supporting people beyond any suicide attempt, including their families and carers. So I think that we are really focused on helping people understand that that connection between violence against women and girls and indeed many of the other socio-economic factors is important for people to understand the connection to suicide risk, so that when they are working with people at the earliest opportunity, they are considering that. We need to use what we know about risk and protective factors, and we now have an awful lot of information so that we can take opportunities to mitigate suicide at the earliest opportunity. Now that could be through the development and delivery of specific suicide prevention action plans. It could be that we are connecting work into wider policies and delivery of action at local level, but also at national level, working right across public protection to look at those socio-economic determinants and inequalities around suicide. And we want to include or integrate suicide prevention into existing support and services through raising awareness and skills for the workforce in key settings, and as I said, raising awareness of the connection between intimate partner violence and suicide. I've put my contact details on because there's no way that in 5 to 10 minutes I could cover everything that we needed to cover. So please do note down my email address, and if there's anything more that you'd like to know about. I know we've touched on, or Elaine and Tam touched on work around reviews, and indeed we're doing a lot of work around suicide reviews, and as I said, feeding into the domestic abuse, homicide and suicide reviews work, and I think improving data and helping us understand what the factors are around suicide and its connection to domestic abuse in Scotland is really important, and being able to share that data across sectors and across partners is vital. I think we often use data protection as an excuse not to do that, and I think we need to work more creatively to overcome that, because we know that people want the help. I'll stop there, Maureen. I've no idea whether I've gone over or not.
And good morning, everyone. First, thanks for inviting me here today to represent Public Health Scotland and share with you some of the work around alcohol harm prevention and the potential links with violence against women and girls. We have, in the past 6 months, formed a new team to look directly at preventing alcohol harm. We're a small team, but we're ambitious, and we look forward to connecting with many of you here in the call today as we shape and progress our work. I've been with Public Health Scotland since its inception in 2020, and I've worked across a variety of topics, and I previously worked with the gender-based violence team. So it's fantastic to have this opportunity to think through what the links are across our programmes of work. I acknowledge that there's a risk we all become entrenched in our day job, and I think we need to challenge ourselves to make those connections and see the linkages and similarities across our topic areas. Next slide, please. Here we go, brilliant. So our team in our early stages, we're developing areas where we feel we can make the most impact, and we have some ambitions to focus on evidence-based primary prevention. So we're looking at opportunities, mainly what we define as the 3 A's. That's affordability, acceptability, accessibility. So you'll know previous work in Public Health Scotland focused on affordability, and we formed the evidence base to support the introduction of minimum unit pricing, setting out our country's ambitions around alcohol affordability. We want to think more about acceptability, how acceptable alcohol is across our society, and we want to look closely at how alcohol is marketed. We've got real ambitions to seek and create evidence around the effects of alcohol advertising, think more about our alcohol industry's involvement in our everyday lives through event sponsorship, targeted social media marketing, etc. And think about the effect targeted alcohol marketing has on our vulnerable groups. Where are the opportunities in our local systems to support the reduction of alcohol acceptability, for example, through advertising or promotion in the public realm, actually, as well? And there's some interesting work happening there in Edinburgh, I believe. We also want to think about how able we are to make informed decisions about alcohol consumption through product labelling, including that health information that's largely controlled by the alcohol industry itself. And finally, thinking about accessibility, we want to put ourselves in a space where we're thinking about how readily accessible alcohol is by looking at areas that we can influence, such as licensing and conditions of sale. So we've got a keen interest in examining how we as a public health system can influence local and national licensing systems. And I'm interested in navigating how we can harness some collective action around this. It's a really challenging area. However, in our first 6 months as a new team, we've focused on 2 pieces of work that don't sit quite so neatly in that area of primary prevention and lean more into the space of early intervention. And I think these are the ones that are going to be of most interest to you all today. It's really important. We've been challenging ourselves to think about the possibility that focusing purely on primary prevention could actually lead to some inequalities for people that are already experiencing harm. So that's something we're keeping in mind. But I'm sure these 2 work areas are going to be interesting to use that you all are working across public protection, and these are examples of where we can improve our partnerships and focus. So next slide, please. So firstly, our team collated some evidence that relate to how people engage with alcohol treatment services, and we're about to publish this report next week entitled Specialist Alcohol and Drugs Treatment, Understanding the Reasons Behind a Reduction in the Number of Referrals in Scotland. Yeah, try saying that in one breath, but a bit of a snappy title there. This work's a result of a qualitative study we undertook as a team, and it reflects on a general trend in reduction of access to specialist alcohol treatment. We wanted to understand the drivers of that reduction. We'll publish this next week. It comes out the 3rd of December, but I can give you a brief overview. I think the findings will be of interest to those of you working across public protection, as they discuss themes that I don't think relate purely to alcohol treatment access, but I think they might be largely recognised across our whole system. I was struck by the similarities between issues people experiencing access to alcohol services and access to services responding to violence. I think there's some real key themes here that we can share. So as a preview, in our findings, we note that there's some real challenges in communicating how to access and refer into alcohol treatment services. We have a constantly evolving landscape of service provision, and there's common themes here for both people that use services and people who work in services and how to communicate service access. Another common theme where we need to address wider unmet needs, including transport, housing, financial hardship, and there's some real similarities here across our whole system. And it made me think about intersections, and that someone who's experiencing violence could face immense barriers to accessing alcohol treatment. And really, in short, what we're saying is nothing can be done in isolation. For us in Public Health Scotland, we recognise our role to draw attention to the importance of adequate resourcing of specialist services and partner agencies to recognise where referrals into alcohol treatment can be supported. So that's a really brief highlight of that work coming out next week. And next slide, please. And that brings me another piece of work we recently completed that I think will be of interest to you, and that was our review of alcohol brief interventions, or ABIs for short. We reviewed the ABI programme across Scotland on behalf of Scottish Government, and we published our findings last month. In Scotland, we've had a programme to implement alcohol screening and brief intervention since 2008. And I think in our own lives, most of us will have received an ABI at some point. It's a short, evidence-based, structured conversation about alcohol consumption. And it should motivate us to think about or plan a change in our drinking and ultimately reduce our consumption and risk of harm. In our review, it found a need for a refreshed approach. We highlighted the need to make the conversation about alcohol into a routine wellbeing conversation. We highlighted the need to reduce stigma about alcohol by having these routine conversations regularly and across a range of settings, not just mainstream health services. And we found that the programme should be flexibly informed by practitioners and their expertise about their own services and the people who use their services. And efforts should really be made to move away from that fixed term of ABI into something that's more of a flexible intervention. And I think importantly, we highlighted that conversations about alcohol must be embedded as part of a wider, comprehensive, population-wide prevention strategy to promote health and reduce inequalities. So I suppose here we started thinking more about stigma, and to combat this requires a shift towards that person-centred, trauma-informed conversation. And for me, this is where we started to think how closely intertwined violence against women and alcohol harm is. There's causes and consequences that continually overlap. So next slide. So thinking about actions, how could we consider then how we shift our thinking from these siloed early interventions and think about how we merge our conversations about violence against women and alcohol harm? Perhaps shifting the separate structured conversations round about routine inquiries and ABIs into a space of these holistic, routine, person-centred wellbeing conversations that could take place across a range of settings. It's timely for us to consider how we mutually understand our service landscapes, make sure we understand the opportunities to respond appropriately and according to the whole person's needs, not just that particular issue that's brought them to a service that day. My past and recent work around about alcohol and past work looking at prevention of violence against women has led me to consider how can we strengthen the links between VAWG services and alcohol and drug services. And I know from experience this happens really well in many areas, and we can perhaps look to develop some learning opportunities. So some considerations from me, and I guess some questions I've been asking myself. Should we consider more cross-workforce training and collaboration to ensure the understanding of the crossover between alcohol and drugs and VAWG services? Can we ensure more collaborative partnerships between agencies referring into and out of services? How can we progress and create sustainable and supportive referral pathways for people? And are there opportunities to develop holistic, person-centred wellbeing conversations across our system? And final slide from me. Just some links here that I've got that I can share with you. Please bear with us. We are refreshing our alcohol web content at Public Health Scotland just now, so that's coming soon in the early in the new year. But we can share the links to the two reports that I've discussed today. Little plug for our alcohol dashboard, which is an analytical tool that breaks down alcohol health harms into locality areas. You might find that interesting. And a couple of other things. We're about to share our a prevention bulletin through the Knowledge Network, so looking at the evidence base round about prevention of alcohol harm as well. And I've just dropped in our team's mailbox there as well. Happy to have a discussion with anybody about anything further. Thanks very much.
Thanks, Maureen, and thanks again for having us along today. Good to see so many people along on the call. I don't have any slides. I was just going to, like others, we're just going to have a chat through some of the areas. And I know on the call, actually, we've got some policing colleagues from across the country, which is really good to see. But in terms of the first question, I think you can probably see the signature of my work streams sort of sitting behind me. So I'm the national lead for Police Scotland for rape and sexual crime, human trafficking and prostitution. I previously worked in the child protection role as well. But I was going to try and stay focused on the areas that I work on now currently. And I guess I see it already, you know, within some silo work, and it already happens within sort of Police Scotland. So it's trying to get rid of the silo working within our own organisation, and that obviously transfers into the much wider side. And there's a lot of work ongoing internally here in Police Scotland to look at our own VAWG implementation plan to make sure that that's more meaningful and we're actually sort of more directed in what we're doing to try and do that. And I think that silo working can come in sometimes when we see certain areas on our VAWG strategy and our own implementation plan. If somebody says rape and sexual crime or human trafficking, it tends to come to me or other leads across local policing divisions, where actually it should be going to the whole organisation, because I think we've all got a footprint in some of those areas. Looking at commercial sexual exploitation is a huge piece of work for us just now, something that we're really steeped into. And our goal is really to try and look at that national policing approach to how we tackle that. We've had some operations standing up recently across the country with a real police focus and trying to work alongside the Scottish Government strategy of challenging men's demand, and really looking at upping the patrols in the areas where we see prostitution for on street across the country, with the police with a real focus on arresting males that are there to buy sex, and try and engage a lot of the women and try and see if we can put them into support services across the country. And it's quite clear that there's some excellent support that's already going across the country, but there's areas in Scotland that maybe don't have the same levels of support, and it's trying to recreate what's happening there elsewhere and bring that to a different area. I think the issues with VAWG and CSEs that a lot of the women encounter, you can't put them into one box. There's lots of different drivers with drug and alcohol, mental health, poverty, all for a kind of need to survive. And that's just looking at the on-street space. In terms of the buyers of sex, so we're kind of perpetrator focused on that side and really want to have, as I say, that consistent approach to try and tackle that. But again, there's a lot of interesting comments in some of the slides. I've seen Hamish's comment, about VAWG goes much wider than public protection. I totally agree with that. Just looking at recent cases that we've had. So, for instance, looking at on street, we've seen some issues that have arisen with taxi drivers licensing, maybe not being quite as innocently minded in that area, and actually, abusing their position of trust. So there's again a real focus on what we can do about licensing to make sure that the right people are in that area, and we question about why certain maybe drivers are in that area at that particular time. Wider than that, the team's been done a lot of analytical work in one part of Scotland looking at landlords to say, do we have enough governance round about landlords, and are they, well, we've seen in certain areas that they are kind of responsible for providing accommodation for pop-up brothels or that short term, or having links to serious and organised crime. So again, to try and cut the head off that side, and prevention would be to look at how we can tackle that landlord space much better. And I guess our real focus is trying to signpost a lot of women that are being exploited, and some of that continues internationally. If we see a lot of women that are returning home, to make sure that level of support continues in their home country or wherever they go next, but also looking for us to join the dots, looking internationally around about commercial sexual exploitation, where we see its links to organised crime, and both internally and internationally. I think a big thing for Police Scotland as well is also recognising our own limitations and understanding our role, and it's known at the right time where we should be handing over to the partners that we engage with that can provide that expert support. Really the policing side's fairly straightforward in terms of investigate and gather evidence and passing that to the Crown Office and Procurator Fiscal Service. But when we deal with victims, we need to ensure that our partners, the key people we deal with, are the ones providing that emotional support. We've got some excellent referral pathways already in place, and I think it's just looking at how we extend that and how we enhance them to make that victim's journey through the criminal justice process a bit more joined up. A lot of people speaking about trauma informed. I think it's really important. We're doing a lot of work across Police Scotland to make sure that our entire workforce is trauma informed. But recognise that we're not the best people to provide that ongoing emotional, practical support to a lot of women recovering from violence or struggling with the criminal justice process. And we've got a really good network that we really need to be kind of looking at that can do that support for us. And essentially, we need to look at the police so that we can be robustly targeting the perpetrators that are causing the most harm to women and girls. I think there's a huge part here about lived experience. And I think that's a huge part for us to be able to join the dots and hear the voices of survivors of abuse that can really help us kind of shape our process. And I think on the back of that, then, it's kind of regular and very honest debriefs collectively across the board with organisations to say what worked well and what didn't work out well, and bring that organisational learning so we can sort of make some change. In terms of the sort of the second question about the actions, I think just the communication's key. I think we have to keep that regular communication between the police and our sort of key partners. I think it's important locally that everybody knows their key partners and how and when that we can contact each other, so that we can all have that collective response to improve a victim's journey, and we can all share issues of what's coming over the hill, what's the next risk that's coming, so we can maybe collectively target that. Just recently, I was at a partnership meeting with an organisation that's been supporting women for a long time through sort of commercial sexual exploitation. And just as part of that conversation, there was a comment made that there's a real increase for commercial sexual exploitation, for prostitution, looking at condomless sex. So that leads into a number of worries about sexual health, but also I left that meeting thinking about the criminality side. May last year, Scotland seen its first conviction for stealthing, and for those not familiar with the term, it goes from essentially non-consensual condom removal, or stealthing is the practice when a man covertly removing or damaging a condom during sexual intercourse when his sex partner has only consented to condom-protected sex. So I'm just wondering how much that message is known externally, but actually we could be dealing with, there's a rape that's happened there. And how we deal with it, how we respond to that. So both externally and internally, and I think there's still a bit of education to do. And I know that as I speak, actually, there's an ongoing meeting just now in Police Scotland where our SIOs for rape and sexual crime are currently meeting, and those topics will be shared so that we can get that learning across the organisation. Investment for training facilities. I think it's in this day and age that we shouldn't have any victims sitting in the front counter at any police station. I think we need to look at the estate and what's available to us, through partners, that we've got a better facilities. I can't speak highly enough of advocacy workers. I think that the support that they offer. I've met with a number of survivors now of abuse, and I don't think we would have got to the basis of the kind of a real honest conversation without the work of the advocacy worker. When I look at our sexual offence liaison officers, I think the training course really needs to be focused, one, through the trauma-informed practice is entwined right through that training. I know that's part of some of the guidelines to bring our specialist officers up to key, but sharing that a bit more widely, what we are doing. And I guess I go back to the point of my lived experience. I just think it's so important. Thankfully, through a lot of the agencies now, we've been able to reach out to a number of survivors who have been absolutely vital in us, building our response, especially to rape and sexual crime. I know there's a few on the call. I think I've seen Brona's name on it, and I'm really looking forward to just over a week's time. I think the TARA group have formed their a TARA advisory group for a lot of women that are survivors of human trafficking, and I think they've got a real key thing to say about how policing can enhance their response, and I think that can go collectively a bit wider. And I think those things are going to be actually key for us to understand where we're not getting it right, what we can do to make things a bit better, but have a much wider conversation with partners to say, actually, there's maybe something that we can do collectively. But Maureen, that was probably me. Just a wee overview from the Police Scotland side. Thanks.